Hello everyone, and thanks for attending my session. I am Omar, and today I will present our research, which is titled as COVID-19 versus social media apps. Does privacy really matter? So let's start. Here is the outline of what we will speak today. We have four sections. We will start with the introduction and motivation, and then we will present our research questions, and then we will discuss the methodology, and finally we will end with our findings. There are some interesting facts that I would like to highlight 4 points of them today. Evidenced by research, COVID-19 contact tracing apps can help in stopping the global pandemic if 60% of the public download and start using these apps. Even lower percentages of using will help in fighting the virus and decrease its propagation. Also, governments are promoting for their residents to download and use COVID-19 apps, and at the same time, some of these governments are restricting the usage of social media apps. Also, people are influenced by media and think their privacy is extremely violated by using COVID-19 apps. There is a huge interest in using social media apps, especially after COVID-19 pandemic, but at the same time, this huge interest is not the same at all with COVID-19 apps, despite their huge importance in the current pandemic, which results in low adoption and download rates for COVID-19 apps. From a software engineering perspective, despite the huge importance of COVID-19 apps, and although they're high funds, there are some development challenges. Since COVID-19 apps are saving lives, and they should be accessible by everyone regardless age, gender, country, culture, etc. So basically, they should be accessible by everyone in the society. But by looking into user reviews, there are significant problems raised by thousands of people. Let's jump to our two main research questions we are addressing in our research. The first research question is about how is personal data handled by COVID-19 and social media apps. And the second research question we are addressing in our research is about the key issues raised by the users of COVID-19 and social media apps, as evidenced in their user reviews. Let's talk about the methodology of our work. Our research consisted of two parts. First, a manual analysis of the privacy policies, terms and conditions, and data user agreements in COVID-19 and highly used social media apps. Secondly, an automated analysis of nearly 2 million user reviews of COVID-19 apps, social media, and productivity apps, which are classified into 5 main aspects, and these reviews are extracted from both Google Play and App Store. So how our automated user reviews analysis tool work? First, it extracts the user reviews from both App Store and Google Play, and then it detects the language of each single review, and then it translates the non-English user reviews to English, and then it classifies each user reviews into one or more like several main aspects to one or more aspect based on a baggage of keywords which we have developed after manually analyzing over than 23,000 user reviews, and then it automatically generates various types of statistics. More details about the tool is found in the paper. Let's jump to the findings. For the privacy policies analysis part, it shows that COVID-19 apps are way more transparent since the majority of them are open source, while all social media apps included in the study were not. Moreover, COVID-19 apps better support privacy and better limit data usage. since the identity of the users are masked and their data is deleted when no longer needed. While in social media apps, users' data is used out of the app's scope and the apps collect more data than it actually needs. But the drawback of COVID-19 apps is that the residents in some countries are forced to use these apps, but on the other side, social media apps are used voluntarily by the users. For more details, a detailed analysis of each app included in the study can be found in the paper. For the user reviews analysis part, we downloaded, analyzed, and classified nearly 2 million user reviews for Facebook, WeChat, TikTok, Grammarly, COVID symptom study, and 21 different COVID-19 apps from different countries around the world. And we classified them into 5 main aspects, which are privacy, stability, advertising, user requests, and installation. This is done using our tool. We can see the number of reviews for each app. And actually, this user reviews analysis showed that COVID-19 apps are less stable and have higher uninstallation rates and user requests than social media apps. But at the same time, they have less advertisements. So we can see here, COVID apps have less advertisements, but they have more stability issues and more uninstallation rates. Here you can see the distribution of different aspects across star ratings in each figure. It was actually interesting to find out that despite privacy was highest raised in COVID-19 apps, the reviews having issues related to privacy was better rated than social media apps. So although people have raised privacy issues in the user reviews, we can see here that most of them have given 5 stars for privacy aspect. And if we compare them to social media, we can see that people, when they raise privacy issues in social media, actually it's usually they are giving 1 star. So it was interesting actually to find that people in their reviews, they were raising that they trust COVID apps as they do not violate their privacy, and even some users made comparisons between COVID apps and social media apps in the reviews. We gave some examples of these reviews and quoted them in the paper, not just for the privacy, but for stability and other aspects included in the study as well. So the major findings of this study is that privacy and personal data are more violated and exposed in social media apps compared to most COVID-19 apps, in which many people have lots of privacy misconceptions about COVID-19 apps. And that's actually why they have low download and adoption rates. Also, more COVID-19 apps reviews talks about privacy issues, but in a positive way. COVID-19 apps usually have many severe bugs and instability and accessibility issues, most likely because they have been developed, designed, and have limited testing in a short time span. Also, health officials and technologists actually need to better raise awareness among people about the trustworthiness of COVID-19 apps, since we can see clearly that lots of people doesn't actually know how even COVID-19 apps, and they just listen from the media. Also, more research needs to be done on how to design and implement any future public service apps or emerging apps that needs to be rolled out quickly, and for sure in a way that allows users to be sure that their privacy is not violated. Thanks all for attending today, and please let me know if you have any questions. Thank you.
Hello, everyone, and welcome to our session about privacy in apps, cases from COVID-19. We are here with one of the authors of the first presentation, Omar Haggag, and Omar will be answering the questions and that you have, or clarification that you have from his presentation. And I can see that we already have a first question from Thomas Welsh. Thomas wants to ask, how do you account for the high number of fake reviews online?
Thanks, Andrea, and thanks, Thomas, for your question. So basically, all the reviews we had in the paper or in our study, we actually translated it to the English language. So there was actually some reviews who were kind of fake, as you are saying, and they are actually not classified to any of those aspects. So they have not been, as I said, classified. So they are not actually in our findings at all. Just ignored them.
Okay, thank you. And we have another question from Stephen Arst. Stephen is asking, you had quite a few reviews about advertising for the COVID apps, if I understand your bar chart correctly. Did you encounter apps with advertising? Or what did people write when they gave 1 star in your advertising bar chart?
Yeah, that's actually a good question, because the majority of COVID apps are actually don't include any ads with them. But however, we found from the reviews that some of the users have kind of reported that there are ads in the apps, which should like. We discovered in a later stage that some very little amount of these apps of COVID apps have ads. So people were generally kind of giving 1 star because they are kind of frustrated that COVID contact tracing apps should be actually helping people with COVID, not just giving them or publishing some ads, like for example social media apps. So that's why the rating of advertisements wasn't that good.
Okay, thank you. While we wait for more questions, I have a question for you. How much do you believe that people were more willing to provide information because was a COVID-19 app instead of being a normal social media type of app? Everyone was, working towards a solution for a threatening problem that we are all living.
Yeah, exactly. And this was actually shown clearly in their reviews, like for social media apps, people, when they are raising privacy concerns, it's usually negative. But however, in the COVID apps, people were willing and actually saying, it doesn't violate privacy and so on, and we're kind of motivating others to download these apps. And some others, were just saying, where is the source codes, where is whatsoever, and we don't believe in the app, it's trying to track us. So like there was a mix between the user reviews, and definitely the reviews doesn't 100% reflect the reality, because the majority actually of people, and this is what we discussed in the paper, didn't actually download or use these apps. So we didn't really have the opinion of those people about why they didn't install these apps. So it's basically the one who installed the app and kind of had the chance or wanted to give a review. This is what we have considered in our study. We didn't have any kind of surveys or whatsoever.
Okay, thank you. Just to remind the audience that Omar will be available in the discussion room for those that would like to discuss more about his work after this session.